Haven't yet hit the peak of flu season. One local hospital says they've already seen more cases of it than this time last year, and also that families with young kids need to be aware of another virus. Today we talked with one family who took their daughter to the hospital because something just didn't seem right.
Snuggled in her daddy's arms with mommy close by, 8-month-old Phoebe is trying to get back to smiling and feeling better.
My mommy instincts kicked in and I was like, this is not good.
Jenna Borenpole brought her little girl to SSM Cardinal Glennon Children's Hospital Monday night because she wasn't eating or going to the bathroom as often as normal and was having trouble breathing.
We could see her ribs when she was taking breaths, and that's not something that you want to see in your baby.
Phoebe has RSV, a virus that causes upper respiratory infections, especially in young children. Like the flu, it's more common to catch during cold months.
A lot of it is spread by droplet. That means you sneeze and these droplets come out of your nose and your throat. And the thing is, in the wintertime, since the air is drier, those droplets will get smaller because they evaporate as they come out, and so that means they can travel farther.
Spending so much time indoors during winter creates a breeding ground for such germs. So far this season, SSM Cardinal Glennon has had 150 cases of RSV and 150 cases of the flu, which is roughly a 40% increase from this time last year. And if last flu season is any indication, we're nowhere in the clear.
Our peak was in late January and early February, so we're kind of heading up to where we expect things to get really bad.
While it sounds redundant, simple habits like coughing in your elbow and washing your hands frequently will help. All things Phoebe's family are doing so they can take their cuddles back home.
Right now, there is not a vaccine for RSV, but if you haven't gotten your flu shot, doctors say you still should do that for the season. Today, though, federal health officials said there is a chance it may not be a match for this year's strain. According to CDC data released last week, if your child is exposed to influenza B, there's a 58% chance that their flu shot will be well matched to protect against it. Doctors say the vaccine is, however, a really good match for the strain called H1N1. However, the flu shot can still save a child's life.